Radiology Department at Ocean Springs Hospital with Lance and Jarrod. They're going to tell us about the cool technology that we have to find all kinds of conditions and diseases that could happen within the human body. So right now we're really focused on screenings. As we know, COVID has delayed a lot of care, as some people were afraid to come into the hospital. Some people had to gone to their checkups. So, Jarrod, tell us a little bit about, the room we're in. What kind of happens here?
This room that we're in today, Sarah, is the Interventional Radiology Suite, or some people call it angiography or special procedures. What we do in this room is kind of similar to the cath lab, where they deal with cardiac side, we deal with everything else. Dr. Walker and Dr. Patton are our interventional radiologists. They'll come in, do embolizations, nephrostomy tubes, anything of that nature to kind of deter you to go from surgery. We try to do everything here, which is less invasive.
So one of the ways they find some of the things that they might need to do, that you might have an issue that they can fix, is through screening. So if you would, tell us a little bit about what are some of the types of screening someone might need, or their primary care physician might ask them to do. They might go and ask any doctor to look at for them.
Okay. Well, let me start by saying that the purpose of screening exams is to detect disease processes early. One of the best ways that we can treat something is to find it as soon as possible, before there are signs and symptoms.
An ounce of prevention is worth a pound of cure.
Exactly. A good example are the bone density exams that we provide for osteoporosis. That has no signs or symptoms at all, so you don't know it until you break a bone.
Wow.
What about lung cancer?
Lung cancer is another one. The earlier that we catch it, the better off the person is. The more treatable it is, and the longer that they can live.
What about these? We hear about these low-dose calcium screens. You always talk about that. What is that exactly? Break it down in terms everyone can understand.
So a calcium scoring is an exam that is done under CT, computed tomography, where we look at the heart itself and the arteries inside. The blood deposits calcium within your arteries, and that is a good detector of what kind of problems you may have later on down the road. It's a good predictor of heart disease.
So if you have a family history of heart disease and your doctor is concerned about your heart, that is something they might ask you to do, is have one of these screenings. Is the process pretty simple? Is it invasive? Is it easy?
It takes less than 5 minutes. Literally.
Less than 5 minutes. And does it hurt?
It does not hurt. Here we're doing a carotid of the ultrasounds. That is one of the screening exams that we perform. Rachel will be looking at the arteries going up into the brain that feed oxygen to the brain, making sure that there's no occlusion.
So it's a simple, non-invasive procedure. It doesn't hurt at all.
Doesn't hurt at all.
That tells you a lot. What are we looking at here?
This is the common carotid artery. We look at it in black and white scale to make sure that there's no intimal thickening, any kind of plaque formation. Then we look at it with color. Use the scale here. Make sure there's complete fill-in.
And that's called color Doppler, isn't it, Rachel?
Yeah, this is color
Like Doppler radar.
And then this is a spectral tracing that shows us our upstroke, systole and diastole. Tells us how fast the speed of blood is. So we go with a different scale, but 125 is basically our threshold. So kind of anything below that would be an acceptable range. And we just kind of follow it up from our common carotid proximally, distally, up to the bulb. And then here's our ICA, the internal vessel. This is what feeds the brain.
Why do you have two different colors there, red and blue?
It's just towards and away from the probe. We kind of keep the red as the arteries and the blue as the veins.
Well, thankfully, Rachel did not find anything too crazy during my procedure, but what were some of the other things that you have found while you were doing the ultrasound that maybe you weren't looking for that were of alarm?
Okay, so ultrasound, I'll just start by saying it's an awesome diagnostic modality. It sees pretty much any kind of soft tissue structure or anything that's fluid filled. Since most of our organs are made of water, it's really good to be able to evaluate them. It is does not use any radiation. It's pretty cost effective and is easily performed and most
Right.
patients are able to do it, like versus might not like to go in an MRI machine. So I would say some of the most common things that I find with ultrasound would be like cysts in the liver, cysts in the kidneys, maybe a kidney stone. Sometimes the kidney stones get blocked in the ureter, which is the tube that connects the kidney to the bladder, and they would get what's called hydronephrosis. So it presents with like flank pain. Most of the times the men say it feels like what they think they're having a baby.
Oh gosh.
So, that's kind of funny. But let's see, gallstones is probably a major one,
Yeah.
right upper quadrant pain, what we call positive nursing sign, and you push right there. Some of the more serious ones would be like, say they come in and are having abdominal pain, nausea and vomiting, they order a gallbladder, and the gallbladder's normal, but I know that something's going on with the patient, so I kind of start, quickly looking, and they might have like a 6 centimeter aortic aneurysm. That would be on the verge of rupturing, which would be a surgical emergency.
That's
So
life-saving.
it is, yes. We save lives every day back here. We might be called to ICU quickly to help Dr. Bobber assess a patient to do a thoracentesis. We go to the OR, I go to the cath lab probably several times a week.
Yeah, I see you guys all over the hospital.
I scanned a brain in surgery when they were trying to localize a mass for a biopsy. Ultrasound is awesome.
Well, you're talented. I appreciate it.
I'm everywhere.
I'm pretty sure you have saved countless lives in our community just by using your machine and your talents. So
Thank you. I enjoy it.
But give us just a general feel for the technology throughout the system that you have, because we've got the 3 hospitals and 2 medical parks that pretty much have just about anything you need, right?
Yes, sir. We have an MRI unit at each facility. We're actually in the process of upgrading the one over at our Gulfport location. We have a wide bore, MRI here, which is pretty much standard for across the.
You don't feel claustrophobic
Yes,
because
sir.
it's so big that you're not in this little bitty tub.
I mean, as you can see, I'm a big boy and I fit comfortably in it, so
yeah.
it's not gonna make you feel claustrophobic or like you're up underneath a hull of a boat.
Right.
So.
So don't let the technology scare you. I think our team does a great job of making everyone feel comfortable. Do you guys agree?
Yes, wholeheartedly.
So who's eligible for screenings, and how would they know what to ask their primary care physician?
That varies by the screening exam itself. For instance, for lung cancer screening, the age limit just expanded from age 50 to 80. And there's also some other criteria. You have to have smoked 20 smoke pack years worth of cigarettes. That's 1 pack a day for 20 years, or 2 packs a day for 10 years.
So if you're a long-term smoker, even if you've quit, there's probably a lot of value in finding out your situation through a screening where you are in the event there's something we can do to help you.
Absolutely. Even if you've quit smoking within the last 15 years, you can qualify for that exam.
That's the
Okay.
thing, is we might not feel the symptoms or signs of it, but that smoking might have already done the damage, and you don't know until you get it done.
And screenings are pretty inexpensive if you have insurance, and we offer cash price on some of them for those who do not.
Right. One of the great things that came out of the Affordable Care Act was the creation of the U.S. Preventative Services Task Force. They are set up to create the guidelines and ensure that the commercial insurance companies pay for them.
That's a very good, well-intended thing, because again, anytime you can prevent something, you can save a person's, make their life better, save their life potentially, and save them money at the same time, and prevent them from having a worse situation down the road.
That's correct. The majority of the screening exams are covered under insurance.
Thank you all for improving health and saving lives.